both sides of the conversation family. We welcome you to this virtual space crafted especially for you. My name is Jada Curry, and I'm both sides of the conversation's marketing director and graphics design specialist. I want to take some time to ground us all as a community into this space we are about to open up in, so let's go through our community standards. Both sides of the conversation is providing a safe and honest space for open conversation, so we ask that you all be respectful of that. We also ask that you be respectful of each panelist, host, and participant. We do encourage healthy debates and conversations. Don't personalize anything with anyone. This includes name-calling, bullying, trolling, or shaming. This will not be allowed or tolerated. Your perspective is yours. It is not a prescription. You do not have to agree, but show respect. These community standards apply to all of our live shows and any virtual spaces that we hold on social media, including YouTube, Facebook, Twitter, or Instagram. We want to make sure that we are caring for each other as a community. This is our priority in all of our endeavors as both sides of the conversation. With that being said, I hope you enjoyed today's show and continue to stay in touch with us via YouTube, Facebook, Twitter, Instagram, or all of them. All right, thank you for listening and see you soon.
Hello, everyone. Thank you for joining us today at Both Sides of the Conversation Live. We meet here every Sunday starting at 2 p.m. My name is Brittany Doyle. I will be your co-host for the afternoon, and I would like to introduce you to my co-host and executive director, Don Henry.
Welcome, everybody, to Both Sides of the Conversation. Today should be a phenomenal conversation. We have some guests that's here today to help educate our community and have a conversation about the COVID-19 vaccination. I know in our community this has been an important conversation. There's so much dialogue and conversation about it. So I'm hoping today these two amazing guests that we have here today will help answer some of the questions and kind of soothe some of the things that our community has been wanting to ask. With that being said, I'm going to go ahead and jump into our world and community announcements today so that we can start getting ready for today's conversation. Just want everybody in the community to know this Saturday, Haiti was hit with a 7.2 earthquake. Major disaster. There has been a current death toll of about 724 people. And I think today, they said it was another 324 people. As they go through the rubble, there will be more and more bodies. I'm sure they're predicting. So I just want community to keep them in your thoughts, prayers. And I'm sure there'll be donations and different things go by to help them out. Don't forget our people down there. Those are our people as well. Also, they have a storm coming in. That could be impacting the rescue effort. So we just got to continue to pray for our people in Haiti. Also, with that being said, in Canada, they're going to be requiring all commercial air, rail, and marine passengers to be vaccinated by the fall. They're looking at October. So if you're planning to travel, ride a train, or do a cruise ship or anything, that they are mandating that you are COVID-19 vaccinated. And I'm sure the U.S. is going to start following a lot of these mandates as things start pushing down throughout the different countries and communities. So that's why this conversation today is so important, so that people could kind of get some of the questions that they have answers or concerns and make that decision. Will you or will you not be vaccinated? Hopefully after today's conversation, more and more people will think about helping so that we could stop the spread of this Delta variant. Also, with that being said, here in the Bay Area, the Bay Area Air Quality Advisory Board has extended the wildlife smoke as smoke is drifting to the South Bay and across the Bay Area. I'm sure a lot of people are smelling the smoke from the fires, which are impacting the air quality for residents in the Bay Area. So please be mindful. Watch our young people, especially people that are impacted by asthma and breathing disorders and things of that nature, as the air quality is getting tougher for them to breathe and just in our air as well. So be mindful of that. check that out. Also, community, there's a heat wave coming in the East Bay. Let's be mindful and solidarity. We keep putting it out there. There are more and more counties now putting water restrictions on our residents. Be mindful of your water usage, watering your gardens and bathing, different things of that nature, washing the cars, as our water shortages are being impacted here in the Bay Area. So please, community, let's do our part. Take shorter showers, or use as much water as we can to help conserve, so that we can have water throughout the rest of this year. And hopefully this rain season we'll get a little bit of snow and rain as we start transitioning to our fall season. With that being said as well, we know this past weekend there was another chemical outbreak, fire at the Richmond refinery. So I'm already seeing that some of the prices of gas are going up, impacted. But for the residents out there, keep them in your prayers. And I know every time we have these chemical release, it definitely impacts people in the community that's in the surrounding areas of the Richmond refinery. We talk about asthma and different health things of that nature. So with that being said, I want to get into a past few events that took place over the weekend. Last Friday, we had a phenomenal event. Both sides of the conversation was a part of Recovery Day in San Francisco at Bodega Park. It was a phenomenal event. I just want to say shout out to all of the vendors, all of the organizations that came out and support. As we know in our communities, especially in San Francisco, substance abuse has been on the top of the radar. So many deaths through fentanyl use and opiate use. And it was just nice to see people who went through recovery processes, advocating for people in the community to get them services and needs. So I want to give a huge shout out to NCLF, Richard Beal, the cast, Chief Fletcher, Steve Adami, a number of organizations that came out to support Feline Dance Crew. A number of organizations, Man in Motion. There was a number of organizations. Cold Tenderloin, want to give a huge shout out to Dale Seymour and Miss Donna over there at Cold Tenderloin. Collective Impact. Director Davis came out to support the event as well. It was just nice to see community out there with the resources and helping each other out as we celebrate those during Recovery Day. So what a phenomenal event that was. And I just want to thank you to all the people who came up and supported us, watch us, and appreciate what we do here at Both Sides of the Conversation for the community. And then this Saturday, what a phenomenal event. Want to give a huge shout out to the B Magic team, the Bayview Magic team, for the backpack giveaway. What a phenomenal event yesterday at 155 Jenny Street. It was so many people out there. I didn't even think it was going to be that many people. I think it was about 600 people. There was 2,500 backpacks. There was a number of community organizations and resources. They had COVID testing, COVID vaccinations, and there were a lot of people in those lines. So just happy to see some of the community taking this COVID serious and was going to get tested and also vaccinated. Us for Us was out there. 100% College Prep. The American Alliance for African American Educators. There was the Bayview Y, Hunters Point Boys and Girls Club. There was a number of organizations that was out there, and just want to say shout out to them. YCD, Black to the Future, a number of organizations that was out there supporting community, and that's what we have to do, continue to support each other in our community. And there was other events going on. We had the African American dancers at Gilman Playground, as well as a food drive up there at Youngblood Park. There are still going to be backpacks available. I know they didn't give out the whole 25. B Magic will be working with some of the community organizations, some of the school leaders, liaisons, to make sure that kids who didn't get backpacks and support, please reach out to them, as they will be getting some of those resources to them. Shout out to Mobilize Love. They came out and fed the people. We had the Mobilized Barbers come out and do haircuts for the kids yesterday. So it's just nice to see a lot of the organizations coming back to help our kids as we're going to start bringing our young people back to school tomorrow. So hopefully this conversation today also will make us all conscious as we are moving forward. Also, upcoming events, Mobilize Love is hosting another community event on August 21st at Orco Park. There are a number of organizations that will be collaborating with that. The City Eats. If you would like to go out there and be a part of it, please go to thecityeats.org or Mobilize Love. Sign up as a volunteer. There is a large need. They're going to be feeding the homeless as well, shoes, different things that they're going to be giving back to impact our community, backpacks, household items, things of that nature to help our community. Please go to Mobilize Love website to sign up, volunteer. form. There's an application that all volunteers have to fill out. But for community, we're going to definitely need some outreach. As we know, sometimes our homeless population don't like to mobilize near the ballpark due to the police and things of that nature. So we're looking for some community leaders and organizations to come out and help get the food out to Market Street and the Tenderloins and around the city, different districts. So looking forward to seeing you all a part of that event as well. And then the last event on August 22nd, the City Eats, Vibes and Smiles, a number of organizations are going to be blessing the Fairfield, Solano County area. They're going to do food distribution to those in need in Fairfield. They're going to be meeting on the corner of West Texas and Beck on August 22nd from 10 a.m. to 11 a.m. And definitely we'll be out there, both sides of the conversation before our show to help support those in need. They'll have the food package. We just need to go out and give it to community. So looking forward to that event. Lastly, our Hidden Gem segment this Tuesday, we'll have another segment where we'll continue to highlight our Black and brown businesses, as well as our community leaders that are doing positive things to impact our community. If you know of Black or brown businesses that need some support, get some free advertising and marketing, please have them come to our website and sign them up so we can get their information out to community and support them as well. This Thursday, we'll have another Educational Thursday presentation. We have a special guest, Vanessa Russell. Love Never Fails. She came on and hosted the human trafficking conversation. They're going to be educating our community about tech, entrepreneurship, and talking about cybersecurity opportunities, how to get into the IT world. So if you have a young person or your organization trying to get young people to work, this is a phenomenal industry that's not going away. As you all been hearing, our country's been attacked with cyber and ransomware. So this is a great way to get our young people and community into this field. So hopefully you all will be able to join us for that Thursday educational. And then next Sunday, we're going to have a conversation about colorism. We're still looking for a few more panelists to have that conversation. But I think it is very, very important conversation to have. So hopefully we'll get some community people to come on to have this conversation about colorism. And then the last Sunday of this month, we'll have another relationship conversation on 8/29. Fellas, we are looking for some of the men of the community. Come on, all the sisters are signing up. We need some of the fellas of the community to come on and have this relationship conversation. So please go to our website, sign up. The first Sunday of September, we'll be having a solidarity and language conversation. Very, very important conversation that we need to have. And then on 9/12, we'll be having the disability conversation, part 2. We'll be reaching out to some of our organizations and some of the city or departments. I reached out to DPH. They'll be coming on to answer some of the questions that our people that was suffering from disabilities had earlier in the year when we had that first conversation. So they'll be coming on to have a conversation with us. With that being said, the last event today, they're having a block party in San Francisco on 3rd Street. If you're out there today, I know some of you watching, get out there and support our young people in the community as they're going to have another block party event today till 4 o'clock. And then today, our young people unveiled the San Francisco African American Culture Center. We want to shout out them and the Chinese Culture Center coming together, putting a beautiful mural with our young people on the corner of 3rd and Quisada, next door to the bank. So if you all get a time, please, Joe, take pictures, pull up. Our president board, Shaman Walton, was out there, a number of community taking pictures. Our young people did a phenomenal job of doing that artwork, putting that mural up. It is very, very beautiful. We'll get some pictures and put them on our website and our social media handles upcoming. But proud to see the two communities coming together, the Asian Community Culture Center and the African American Culture Center coming together, putting that all together. So with that being said, I'm landing my plane. I'm done. I'm going to go ahead and pass it over to Brittany so we could go ahead and introduce our two phenomenal guests and get started with today's conversation. Brittany?
Yes, thank you. Yeah, the community was on fire this weekend. It was all kind of events going on. So shout out to everyone that is just doing great things out there in the community. So yes, we'll be meeting our panelists in a minute. We have a lot of burning questions for them today. There's been a lot of questions around the COVID-19 Delta variant, the booster shots, the age requirements for the vaccine. And so I just wanted to go through a little bit of the background information to provide some facts around the COVID and just basically what we know so far. So 70% of the US population has had at least one dose of the COVID-19 vaccine. California has a 54% vaccination rate, where the US has a 51%. vaccination rate. As of August 2nd, less than half of the Black and Latinx community has received at least one dose of the COVID vaccine. More employers are requiring employees to be vaccinated. The Pfizer COVID-19 vaccine received full approval from the FDA, and that's going to be expected to happen around September. The current timetable for vaccine for children under 12 is the fall or early winter. I think I heard sometime around December. The FDA has approved emergency use authorization for the COVID-19 vaccine. So we do know this already, that and the argument has been whether it's effective against asymptomatic and symptomatic infections and death. According to the CDC, the COVID vaccines are recommended for everyone 12 years and older. Researchers concluded that the Moderna vaccine provides protection for at least 6 months or more from the Delta variant. There was a case study that was done by the Mayo Clinic that indicated although Pfizer and Moderna vaccines are highly effective in protecting the population from severe disease and death, Moderna has a 76% effective rate against the Delta variant, where Pfizer has a 42% effective rate. And I haven't really heard anything about Johnson & Johnson, period. But we do know how effective Moderna and Pfizer have been against the Delta variant. Since the shelter-in-place ban has been lifted and people have begun to gather in large crowds, there has been an uptick in the COVID infections. And if you follow Rafiki Wellness on social media, they kind of highlight, how many people they're testing positive on a daily basis. So you kind of get an idea of what's going on in the 94124 neighborhood. Let's see, CDC strongly encourages officials to maximize efforts to vaccinate the US population, which a lot of people believe is very critical. The federal, state, and local officials have required that healthcare workers, state employees, teachers, and staff get vaccinated or agree to weekly COVID testing. We know the military personnel is required to be fully vaccinated by mid-September. President Biden has mandated that all federal employees are vaccinated. Just recently, we know that our mayor, London Breed, announced the health order, which will require all businesses in San Francisco with indoor high contact sectors to obtain proof of vaccinations in bars, gyms, restaurants, and entertainment settings by August 20th. And so for anyone that was going out this weekend, myself included, that was trying to go get brunch and you're with people that are unvaccinated, it's very hard to get into restaurants right now if you don't have proof of vaccination. Concert promoters are now requiring proof of vaccination to attend concerts like Coachella. All of our well-known tech companies like Google, Facebook, Tyson, United Airlines, they're requiring their employees to get vaccinated. So we know that this is about to be a huge thing that's going to happen. We also know that many people are hesitating to get vaccinated because of religious beliefs or the mistrust that they have in Western medicine. Due to the perils in the past of people of color. In addition, many people feel that the vaccine will prevent them from getting pregnant or extending their families. They feel that if they get a vaccine, it will cause them to have a positive test, preventing them to go to functions or to go back to work or, just to get that card to move around freely. Let's see, others argue that vaccines will also alter their DNA. Or cause like vaccine shedding. I mean, we've been hearing all sorts of things, and that's what we're going to address today. Let's see, last thing is that although health officials and clinical staff encourage patients to get vaccinated, many argue that the mandate is unconstitutional and infringes on people's human rights. So as you can see or hear that we have a lot to talk about today. And so I would like to introduce our panel. We have two people here today that is going to talk to us, educate us, answer any questions that we have. So feel free to type in and send in your questions. They'll be able to answer them here real time. No question is a dumb question. We want to get everything answered today the best way that we can. So I would like to bring up first Dr. Malcolm John, and we would like to give each of our panelists 1 to 2 minutes just to give some background information for us so that we know, who we're going to be listening to today. So Dr. Malcolm John, thank you for joining us.
Thank you, Brittany. Thank you, John, and welcome everyone. Thank you for joining us today and coming out and sharing your questions and concerns. I'm Malcolm John. I'm an infectious disease doctor at UCSF, University of California, San Francisco here. And I've been here since 1997, where I was an infectious disease fellow, stayed on faculty since 2000, was director of the HIV clinic at Parnassus, the smaller version of the one at San Francisco General, for about 18 years, where I focused on health disparities in HIV, started a Men of Color program, a Black Health Center of Excellence, and worked with a number of community partners and over the years. And from that, really have branched over the last 5 years to focus on health care equity within the institution. How do we make health systems work better for the Black community and others? And my other half hat, if you will, is working with Brittany on an initiative we started last fall called the Black Health Initiative, which is working to help UCSF be a better partner with the Black community to address some of the issues that were raised. We know there are a lot of reasons why folks in our community are very hesitant or have good reason to have mistrust with the healthcare systems, given things that have happened over hundreds of years, right? Including Tuskegee, but many more things as well. But we also know our community does a great job of being resilient and taking care of ourselves and our own. And so it's really important, I believe, that institutions like UCSF learn to be a better partner through work listening, non-transactional engagements, being just present and a good resource. And so we're really happy with some of the work we've been doing with the Faith-Based Coalition on vaccinations in the community, but also education, a lot of webinars, shows like this, and also, quite frankly, our main focus is our new initiative, Healthy Street, which is really around prevention and education and providing services that we hear the community wants and needs. So I'm really excited to be here. I spend my day job clinically about 6 weeks a year in the hospital working with patients, COVID patients and others. I have a clinic a week or two around HIV. I'm married. My wife is a general internist. I have a 21-year-old daughter, a cat, 2 cats, a dog, and a house here in the city. I think that's me. So I always tell folks when I do this talk that I'm here, or Q webinars, that I'm here really as a resource. It's not to convince anyone to get the vaccine or not. Although if you ask me my medical opinion, it's unwavering. We should all get the vaccine, and I could talk about why that is. But really, it's important for people to help people make decisions from a position of strength and good information, and not from fear or anger. And I think that's when we're most at risk of making poor decisions. So it's really to really address anyone's concerns so they can feel confident in their decision, not based in fear, not based in misinformation, not based in anger. So that's me in a nutshell. Thank you all.
Thank you so much. Yeah, Dr. John and I have done a lot of Q&As together over the past year. We have pretty much heard it all. So I'm like really excited to see. I've been looking in the comments so far already, seeing some of the stuff. Patrick's time, we see you, and these comments you put in here. So, but these are none of this is new. Well, actually, the PhD, the vaccine hesitant group, is new. So I'm gonna have to research that one. Next, we have Nicole Howard. Thank you for joining us.
Yeah, unmute yourself, Nicole.
I'm just trying to be safe. Anyway, thank you guys for having me again. I've actually been on both sides of the conversation before, and I had an amazing time, and I'm really grateful that I was invited again. I am a registered nurse. I currently have my master's, my MSN, and my PHN. I have been with the Department of Public Health since last June. I actually joined the facility right in the middle of the pandemic. I actually was interviewed for a different role, and HR called me and said, we need you over here. So I was super blessed to be kind of contributing to getting us back to a normal and or new normal here in the community. I also work at San Ramon Regional Medical Center, where I do.
Uh-oh, we lost your audio. We can't hear you. I don't know if you lost your audio.
Can you hear me now?
Yep, we can hear you now. Sorry about that. Something happened.
Okay. It said that the host muted me. Anyways, I'm sorry. So yeah, I work at, I'm doing informatics, but I've been working really with the Department of Public Health. I actually been in the community giving out vaccines, doing COVID tests. I was privileged to go to SFG and give out the first round of vaccinations. I've administered both Pfizer as well as Moderna. And it is so nice to be a brown clinician and able to provide support to my people in the community. So I feel honored and privileged to not only be out in the community, but be here giving information, because that is what, like Dr. John said, we are giving information and trying to inform the uninformed. I am also a mom. I have a 20-year-old student athlete. He plays for Reno, go Wolfpack. And so my son is also vaccinated, and he, like lots of you, have had a lot of questions about the vaccine, and I was super proud of him for asking questions, even though, I'm his mom. And between the both of us, we have 3 dogs. I'm actually dog sitting. My son left his dog with me when he went away to college. So just like you and everybody else, we're just a normal family trying to get through with this pandemic and get us back to being able to have fun and spend time with our families. And thank you, both sides of the conversation, for having me.
No problem. Thank you very much. And to all of our community, I see people in the chats. I know this conversation is going to be a very triggering conversation. Please be respectful of our community standards and our community rules. These people are here today to educate us, give us the information. Again, your vision or your prescription is not a prescription for everybody. So please be respectful of that. Be respectful of our guests. I do see the comments. We do want to hear from community. I know there's a lot of outrage, a lot of different things that people have questions about, but please keep your comments respectful in our chat, and you could agree to disagree, and that's fine. That's why we have both sides of the conversation, but please keep it respectful, because I don't want to have to block anybody off our YouTube channel for being disrespectful and disrespecting our community standards. So please be mindful of it. It's okay to have your frustrations. It's okay to have different questions, but be respectful of our community standards. And if you don't know, go back to the beginning of the video and you'll hear Jada going over our community standards to community. But with that being said, we're going to open up the conversation today. We had questions who came in from community. Originally, one of the questions we're going to put up here on the screen as we open up the conversation. This conversation is popcorn style. We do have a number of questions that community did ask. We'll try to definitely receive as many of the questions and comments in the chat as well to start this conversation off. But just wanted to put that out there to make sure that everybody understands the standards that we hold here at both sides of the conversation. We're not here to attack or butcher anybody. They're giving us a professional point of view. And they're part of our community as well. So just remember that, community. And anybody that's trying to make comments, I see some of the comments coming in from Facebook. You have to go to our YouTube channel, both sides of the conversation, use the live chat function so we can get your questions up, or go to our Facebook page, both sides of the conversation, so that we could get the comments up. I know a lot of people are watching from my both sides of John Henry personal page, but those questions we can't see, and that's why it's kind of skewed. So please use the right way if you want to interact in today's conversation. Use our both sides of the conversation live chat on our YouTube, or go to the both sides of the conversation Facebook page. Thank you very much. With that being said, we're going to open up with the first question that we got as we start this educational piece about the COVID vaccination. One of the major questions that came in from community was, if people that were vaccinated, can they spread it to somebody else? So if you guys, one of you two, want to start, and we'll just keep going back and forth to get through these questions and as we open up the conversation.
Yeah, Nicole, do you want me to take that one? Yeah, so, a fully vaccinated person, can they spread COVID? Great question. Was the big question when the vaccines first came out. And with the ancestral strain, the alpha variant, the answer was very, very low probability. Unfortunately, with the Delta strain, we do know that viral titers in people who are vaccinated and do become infected are very similar. And I see something in the chat about CT rates, it's a little more technical perhaps for the general population, but it's really around measuring sort of that PCR cycles, how far out you can essentially dilute out and still get infection. But the long story short is it's very similar in some studies. Vaccinated people who are infected with Delta can potentially transmit it. The good news is there was data from Singapore that the vaccinated people clear it faster. So that window of transmissibility from vaccinated people with Delta is shorter than unvaccinated people. So unfortunately, this is the thing with the virus, is that it's changing and it's hard to predict. And I think one of the things with this epidemic or pandemic really is there has to be humility. And I feel sometimes there isn't humility enough on both sides of the argument. We don't know everything. We got to follow the science. That's how we have advanced healthcare. There's no question that we live longer, that many of us have better lives, that we can do better with cancer treatment. Is it perfect? Of course not. And is it reasonable, or rather, is it unreasonable for someone to say, hey, there's a new vaccine. I want to wait a year, maybe 2, see how it plays out before I get it? Of course not. But the challenge is the pandemic, the virus, is not waiting for us and for our timeline. And it's changing and becoming potentially more dangerous. Well, it's definitely more dangerous with Delta. So this is one for the history books. It's not a footnote in history. People will be talking about this for hundreds of years. So we are being put in situations that challenge us to make decisions that we may not always do. Like, we may not usually get a vaccine, but this time you might actually get a vaccine because of the nature of this pandemic. It will be difficult for all of us, no matter what decisions we make. And that is because we are in between a rock and a hard place. So humility all around, I think, is really important for us to understand. We know some things, and some things that we thought we know changes. And that is true for both sides of the conversation. So, but the answer to the question is, unfortunately, with Delta, vaccinated people can transmit. The good news is a shorter window of transmission.
Yeah, I know that there's been a lot of conversation around it being it's riskier for unvaccinated people to be around vaccinated people than it is for an unvaccinated person to go out in the community, because they're saying that it's unknown. You're now saying that the transmission time is short, but there has definitely been a lot of conversation about the unknown of if a vaccinated person could be a carrier, and be asymptomatic and not even know, and then spread it to someone that is unvaccinated. You're muted, Dr. John.
So that's a great question. The challenge with the data that's coming out during this pandemic is so much data is coming out. It's like really putting your mouth to a fire hose, right? There's so much data, and there's a lot of true and unrelated. So let's be clear. The vaccines overall work. You mentioned at the top of the hour that there was data from Mayo Clinic and perhaps from Israel as well, showing that Moderna, Mayo showed that Moderna did better than Pfizer in terms of protecting from Delta variant. The data from Israel was just looking at the Pfizer efficacy. But remember, those data is looking at all infections, and some other studies that suggested that they both were effective in the 80% range. I think it's probably closer to something to what we heard from Mayo Clinics, since they have such an extensive network, but we'll see as more data comes out. But what was key in that data is that they were both equally effective in preventing hospitalizations and deaths. So I just wanted to mention that just to clarify, because I think it's easy for people to confound. Now let's talk about the risk of being with a vaccinated person. The vaccines actually work. The rate of these so-called breakthroughs are very low. Remember, no vaccine's 100%, right? And so we would expect, for example, in San Francisco right now, I think Bob Wachter, chairman of medicine at UCSF, on his Twitter feed, did the calculation to show that we would have expected about 447 or something hospitalizations with COVID had we did not have the vaccine. And with the vaccinated population, we see it an 85% reduction, so it's about 77 cases. The vaccines actually work. Most vaccinated people will not get infected. It's less than, I think you're at 99.99% likely to not get infected. So most people will not get infected in general, in the larger scope. Of course, with Delta, it's going to be different. That being said, the way to protect people from getting infected is for more people to be vaccinated. Your risk is higher migrating among a population of unvaccinated or mixed vaccinated crowds. I don't know if that was clear, but I just like this analogy that people give. The vaccine is like an umbrella in a shower, so it protects you. But if the shower storm is really extensive, a lot more downpour, more viral mutation and variants. Remember, Delta is more transmissible, right? So you're getting a lot more. For every one person, you're getting somewhere between 5 and 9 people being infected, as opposed to the original, somewhere between 2 and 3. So you got it. But now if you got this downpour that's coming on, you're still going to get wet. And now you need a raincoat. And that's why they ask for vaccinated people to now wear masks indoors or to socially distance, because now we've got this downpour and we control that. Potentially we can control that downpour, right? We have an environmental, like climate change, right? We're contributing to that climate change. I don't know if that's clear, but anyway, I digressed a little bit.
Go ahead, Nicole, you could jump in there.
I was going to say, I love that analogy. I've used something a little bit, especially when I'm talking with my youth, like my son. I said, the vaccine is like a condom. People get pregnant, people get stuff with condoms, but you got something just in case, so you got some type of protection. But I agree with the physician, and I'm loving the data that you're pulling out, because I think people are hearing a lot, and we have to give the humility. Is super important, because this is all new for everyone, but we're fortunate enough to have some experts out there. So I think that's great. Yeah, it's true.
Now I don't know about the condom analogy there. Too many babies with condoms now. I don't know if that's a good.
No, that's what I meant. It's not 100%.
Right.
I'm going to tell them to wear one.
But I just want to round this up by saying, if you look at the Kaiser Family Foundation review, they report at the end of July 30th, the rate of breakthrough cases reported among those fully vaccinated is well below 1% in all reporting states, ranging from 0.01% in Connecticut to 0.29% in Alaska. I do think that Washington State has had some recent data that suggests they can see up to 7% of their vaccinated population getting the Delta variant in that state, which has been kind of very prevalent. But by far, most infections are your risk is higher if you're unvaccinated. I saw in the chat this question that most of the vaccinated most people who get infection are vaccinated. It's not. That is a misunderstanding of a truth, which is in communities with high vaccination rates, right? You are going to see breakthrough cases, right? So based on the efficacy data that we have with the current vaccines, which are miracle efficacies, 90-something percent in the original variant, and maybe 80-something, 70-something percent with the Delta variant, you still would expect, by math, about 500,000 cases. So when you have a city where 80% of people are vaccinated, by number, absolute number, the people who get infected will be those who have been vaccinated. But the ones who get sick, right? So the rate of so looking at that denominator, people who are unvaccinated, they will have higher rates of infection within that small circle, but their absolute number will be smaller. And when you look at who's hospitalized and who's dying, we see what we see right now. 97% of those in the hospital are unvaccinated. So this is where true, and that connection can get muddled when people start to twist data to support different positions. And that's why I say we all need to take a step back, take a breath, be humble, and really understand what the numbers actually are telling us.
Wow, great information. Patrick Ty has a number of questions. There's a number of other people in the chats. We'll start getting through some of the community conversations. We had some to kind of kick the conversation off, but I see they're starting to roll in, and we'll try to get you guys to answer some of those questions. Some of these questions, I don't even have a clue what it is, so maybe you can help the community, but also community out there. I had to say it again last week, this week. Can you guys stop texting me the questions for our panelists? Please go to our YouTube channel and put the questions in the chat. I know so many people love me and like to just connect directly to me, but please go to the YouTube channel, put the questions in the chat, please use our Facebook page so that you guys can ask the panelists those questions. I can't do the show and answer your text messages for the questions. So just wanted to put that out there. But Patrick Tom has a question. How accurate is the PCR test and what is the current CT rates? I don't know what that is. So if you guys can explain to me what that is, how does this work with the virus or the vaccination, let me know. If not, we can move on to the question because I don't have a clue what that is.
Is that for me or?
Go ahead, doctor. You can answer those questions. PCR test as far as the accuracy of COVID. I think right now, what is it, like 80?
I'm sorry, what's, maybe I'm missing the question. What's the
How
question?
accurate is the PCR test?
So the accuracy of the general nasal swab is probably what they're talking about. Is that the sensitivity and specificity, if that's what they're talking about as well, in the high 90s, close to 99% or so. It's less so for the antigen test, which is why we always confirm that with a PCR test. So I don't know if that's the question that they're asking, but that's,
How is the antigen test collected?
And I would say it varies by the day of your testing, right? So you're more likely in the early days, I think in the first 4 days, to test negative. So, as we know, it's more accurate after you kind of have about that 4 to 7 day window after exposure. So that's the caveat in terms of the PCR sensitivity and specificity. And that sensitivity specificity is pretty good out to about a week or two after initial infection. The cycle threshold is the CT thing, is sort of the cycles on the PCR for which how far out you can continue to detect the virus with each PCR cycle. It means you kind of have smaller and smaller amounts, and the question is, at what level is it still infective or not? And that's a little bit more complicated. It's the number of cycles needed to amplify out your viral RNA to a detectable level so that we know it. And so most infections, definitely under south of 21 cycles, is definitely infectious. We usually say about 30 and above, it's non-infectious. And I think I saw in the chat accurately that in people who are vaccinated and infected with Delta, the CT values are equivalent to uninfected, but again, that changes and clears very rapidly. I don't know if that's sufficient. If anyone needs clarification, please put it in the chat and we can clarify further. But for the sake of keeping it short, that's...
Well, I like that information. But one of the questions I had, because I know that we're having rapid testing everywhere, people that are not vaccinated are being asked to test weekly. And I just wanted to know for community, is there a potential that a person could have those symptoms that could be deemed as Delta or COVID, but still test positive? Because I've heard people say that they felt like they had the symptoms or they lost their taste and smell, but when they went to go get tested, it came back negative. Is that a possibility, or how are we on when we get that test? Is it 100%, 90%, or could people actually have symptoms and still test negative? Test negative. Is that a realistic thing or not?
There is an infectious period that the symptomatic and non-symptomatic patient have. If you've been, that's why they ask you, though, have you been exposed, and all the different things of trying to wean it out, because there is a potential for you to have a false negative. And so they ask you, and the rapid ones, if it tests inconclusive, then they encourage you to get the test where you get your results within 48 hours. But they are going to treat you like you should be acting as if you are positive. So you should be still, staying away from folks, especially if you've been exposed. But it's such a phenomenon with the infectious period with COVID and the symptomatic versus the asymptomatic folks. It's one of the parts of this pandemic that is such a phenomenon. You hear the people all the time saying, I had no idea, or I didn't know, or I did everything I was supposed to do. I wore my mask and this is what happened. So it's one of those things where it's such a phenomenon that if you are exposed or if somebody calls you, and there's the great apps on the phone that kind of can alert you and tell you whether you've been exposed at a close contact and that you need to go get tested. And so it's just a matter of being almost overly precautious. And again, it's so much a phenomenon. It doesn't make any sense to all of us. The whole testing twice a week and everyone's getting that, burnt out. But the humility that the physician talked about earlier goes with this also. This is part of us as a human race and a culture figuring this thing out all together.
Yeah, I agree. I think to answer the question on the screen and earlier, if you are symptomatic, you're more likely to test positive than if you're asymptomatic. So the question I would have for the person who posed the question is, did they get tested with an antigen test or did they get tested with a nucleic acid test? The antigen is looking at like the spike protein in a sort of ELISA assay, whereas the nucleic test is you're really looking for the mRNA and putting it in a PCR machine and amplifying it out and looking for a signal. So the PCR tends to be more sensitive. That's the nasal swab, the original test. It tends to be in symptomatic people, we say close to 100% positive, but it's not 100% positive, but it's close to. And if we have a concern in someone and the first test is negative, our protocol is to do a second PCR test. And then you can also ask for a cycle threshold if there's a question on whether or not it's an accurate test. But usually the PCR is very positive. If it's an antigen test, its probability of being accurate is not so great if you're asymptomatic. If you're symptomatic, it tends to be in the 95% plus range. And a positive test you can believe. A negative test in someone who's symptomatic, like you just described, warrants a PCR test to see if they truly are infected. And yes, asymptomatic people can transmit the virus. Early on, there was some question about what percent of such transmission. People talked about numbers about 49, 50% of transmissions occurring in that sort of early infectious period where people don't know they're positive and they were transmitting the virus.
Thank you for eloquently putting that out there, doctor. But also remember the community we talking to, because you lost me here for a second, but you brought it back with the nose swab.
Okay, sorry. Well,
I know you.
Someone asked me very technical questions, so I don't know how technical they want me to be. So yes, I will try and I'll try and keep that in mind.
So Patrick must have some kind of medical background or really educated in that area before our larger community that we're trying to get this information to. Let's remember who we talking to. We want to meet them where they at and keep it as simple as possible. But thank you, Patrick, for that question. Because I wanted to also ask, when we first started doing our test, it was the nose swab and stuff. And then they started doing the mouth swab. Is those numbers changing or is it still the same? Is it more effective now just to do the mouth swab or the nose and the mouth swabs?
We do usually both a nasal and a pharyngeal swab. The combination is the most sensitive if you do both.
Okay, cool. Great information to know. I know when I first got mine, they used to stick it all the way in there. I was like,
Yeah, no. Now we do the half.
Now they don't go as far.
Yeah, the early and the little swab, yeah.
They say if you drop a tear, they're doing it right.
All right, we're going to keep moving down. There's a number of questions, but we're going to continue just to move down a couple of these. We'll get to our base questions, but it's more data. I know, Nicole, you said you have a bunch of data stuff, so maybe you could talk about some of that shortly. But Patrick's asking about some data. Have you guys looked from the mRNA research done on lab wraps?
I'm not sure.
I actually have some questions around messaging.
Go ahead, Brittany.
Yeah. So there are a lot of questions have been popping up around the messages that have been put out around the Delta variant. And the way that it's being put out in the community is as if it's something completely different from COVID. So is the Delta variant a variant of COVID, or is it something separate than COVID?
It's a variant. So it's a variant. I think, let's see, what are we trying to point out here? I think the main thing is that it has upended expectations. So we were feeling very confident, and when I say we, I mean the medical field, that we were going to be okay until like the flu season or something like that, right? But Delta showed up earlier and took over earlier in the summertime when we should be, quote unquote, at lower risk. And I think part of the understanding is the virus has changed from an infectious rate, the so-called R naught, from 2 to 3 to about, I think people are settling at 6 or 7, but as I said, from 5 to 9, meaning that one person previously could infect somewhere between, let's say, 2.5 people with the original variant, but with Delta, one person can infect 7 to 9 people. What does that mean? That after, 10 cycles, 9 million people might be infected with the original strain, but 90 million people would be infected with the Delta strain. I believe George Rutherford mentioned that at our recent town hall here at UCSF on Thursday. So that is different. And that in turn changes what we need for quote unquote herd immunity or herd protection. Instead of needing something in the 70% range of people either infected or vaccinated, we now need about 85% if Delta is around. It also means that instead of needing prolonged exposure, we were saying you had to be in an indoor setting, or prolonged close exposure for about 15 minutes for you to get infected with the original variant, you need perhaps 5 minutes or so or less with the Delta variant because of the contagiousness, the rate it spreads. We kind of knew the risk factors with the original variant. We're still learning about Delta, about that. So I think that's one thing that can lead to some confusion with people. Like, is it more dangerous beyond the transmission risk? Well, yes and no. Yes, in the sense that yes, and we don't know. Yes, in the sense that we know the more people who are infected, the more people end up in the hospital, and more people who will die because the hospitals are overwhelmed. Not necessarily that we couldn't save them, right? It's just that we are overwhelmed as a system, right? And that's the whole thing. And so that was another piece or something that people are struggling with Delta. And then, of course, the efficacy of the vaccines we discussed at the top of the hour may be different. And certainly we're fortunate that so far the efficacy against hospitalizations and deaths are pretty close to what we have expected. The immunity we were thinking was going to last a long time against Delta. It seems that it may not, but again, we're still learning about that. And that before, with the original variant, vaccinated people could not spread it, as I mentioned, but vaccinated people can probably spread it for a short period of time, but still could probably spread it because of the nature of the contagiousness of Delta and how much it replicates in your nose. So I hope that answers that question.
Oh, that was pretty good. Feline Finesse, they're asking, what is the best advice or support regarding COVID for our young people going back to school? We know tomorrow in San Francisco and a lot of places across the Bay Area are going back to school this week. Because the younger people are not being able to get vaccinated. I know there was a school district I was reading in the paper. I don't know if it was Brentwood or in Contra Costa County. About 47 kids the first week of school tested positive. And I think they're considering closing the school back down. Is that a fear or concern that the young people could be passing this? And how realistic is it? I know school's coming back, but because we can't give these young people the vaccination, like, is the probability even higher now that once schools start back and people are socializing, that we're going to have even more of an increase? And how do us as parents and community people, how do we prepare for that?
I can take a little bit of that because I have a lot of friends that have young folks that are going back to school. Sadly, there's still some mismessaging in the schools also about masking, and kids are they're just little petri dishes, and unfortunately, with the vaccine not being available for the 12 and under, we have to be hyper vigilant with the kids. And it is a very big safety concerns. One of my girlfriends, she had to actually talk to the school because the school out here in Solano County was saying, well, we're going to just act like you act at home and be very laissez-faire about masking and all this and that. And I'm like, that's really a dangerous place to be. And we need to take it really, really seriously. And so I think that the schools, my heart goes out to the parents of young folk with the children out there, because you don't know whether to keep them home. You don't know whether to send them to school. It's maybe not your kid. It may be another kid's family, and kids are kids. And, some of them are really diligent about wearing their mask and some of them aren't. But I don't know. Doctor, what do you think about them changing the school protocols and stuff, especially with the elementary kids?
Yeah, I am going to say follow the guidance of our public health department here. I think there are a lot of factors to weigh, but I really believe kids need to get back to school. I mean, that's the bottom line. So, there are things we can do as adults, or those of us who are able to either vaccinate, wear a mask, social distance. The challenge is when folks don't want to do any of the above, right? And the adults who are in the schools need to be vaccinated at minimum to prevent kids from getting it and bringing it home to those who might be at risk. But it's a tough situation, but I don't know how they solve it. I think we have several ideas on the table, but kids need to get back to school.
Yeah, I definitely agree with you. But one of the concerns, one of the biggest questions and comments that's coming on, especially in our Black and brown community, and I've tried to talk to people. I'm fully vaccinated. So many rumors and misled information. You're going to die. They're putting community chips in you. You're going to have 10 fingers. Your eyes going to fall out. You're going to lose your vision. There's so many of these stories. As a community leader, I was very hesitant of getting the vaccination at first. But seeing the progression of what was happening, with my family, my mom, elders, and community around people, I wanted to do my part as a leader to make sure that I'm vaccinated. And again, I'm not here to encourage anybody, but just really here to get the information to let people know why. One of the biggest things in our community, Dr. Malcolm and Nicole, is people are hesitant to get the vaccination now because people that are vaccinated are starting to get the virus, right? So a lot of people are like, why should I get the vaccination anyway? If I get vaccinated, I still could catch it. Could you kind of speak to that? Like, why is it important to get the vaccination? And if you do catch it, some of the benefits of having the vaccination, and how it impacts you if you need medical attention?
So currently right now, I'm actually on the sf.gov page, and I'm just going to read just a little data. So currently, as of 8/6, non-fully vaccinated folks, we have a 78.8 per 1,000 cases that are in the hospital. And these are folks that are not vaccinated. And then the fully vaccinated folks, we have 10.3 per 1,000 cases that have COVID being fully vaccinated. So I think if you're looking at numbers, you have a greater risk of being in the hospital and potentially being on a vent and potentially expiring and or dying if you don't have the vaccine. So those are your choices right now. And I understand the hesitancy. I was actually out at Department of DPW, and we were doing vaccines on site. And I've seen so many, they were shaking. People that looked like you and I were out there shaking, scared to get this vaccine. And my role there was to share with them, I'm vaccinated, share the data, share what I know. And some of the folks, they did change their mind. Some didn't. Some waited, like what we'll see when you get back. But a lot of people have that hesitancy, and you have that right to have it. But get your information and get your information that is valid, and do what's best. I told some of these folks, you are the breadwinner for your family. If you get hospitalized, potentially the whole family suffers. It's not just about you. And you're out in the community. Like for me, I still work out in the field. I come home, I've been in the hospital, I've been in the community, potentially bringing things home to my family. And so I have a duty to protect myself so I can protect other people. So the hesitancy is, to me, is normal. as we should be. We should have this due diligence and hesitancy about a lot of things. For some reason, we coming together on this one. As a community, we're more hesitant on this vaccine than anything else that is hitting our community. We are like taking a stance, but nothing else that is taking us out. I don't see as much passion. And so I'm saying, get your information, make an informed decision. And to me, I feel like unfortunately, but I move with the science because I studied it, and I'm sure Dr. John will agree. You kind of have to. We're in a phenomenon, like I said earlier.
And Dr. John, before you speak, I just want to make sure it's clear so we understand this right in community, because I've been watching some of the news stories, some of the heartbreaking stories of people who refused to take the vaccination, then they caught the virus. And then a lot of them were asking, can I get the vaccination? So is it true that if you don't get the vaccination and you catch COVID, they can't give you the vaccination while you sick with COVID? And then a lot of those people, I know a couple of people, family members died. So can you just clarify that? Because I don't want to speak out of turn, but I know there was people who were catching the virus and was asking the doctors to actually give them the vaccination after they had it. So is that true? You can't get it after, or you can, or just educate the community on that?
Yeah. I mean, I want to thank Nicole for her comments. The questions, it's just, when I hear all these concerns, it's really important for us to hear people, validate, because we have good reasons to be hesitant, to do our due diligence, to have mistrust. But at the same time, we also want to take care of ourselves and our families, our community, because no one else will. I mean, history tells us if we don't, who will? And it's one thing to have mistrust and question. It's another thing to turn away benefits that we have earned for all the hard work that we've done in this country. Why should we not benefit from what can be potentially life-saving? I think when we talk about why should I get vaccinated if people get infected, I think we've talked about this before. And we just heard the data about the hospitalizations and death. You get vaccinated first and foremost to prevent yourself from dying of this disease. We do have a lot better treatment today than we did in the past at the start of this pandemic, things that we are learning about. But people still are dying. And part of that, as I said, is that the system becomes overwhelmed with the number of infections. And part of it is that we still cannot predict who will do poorly. It is that immune response in the second week of infection that causes people to die, primarily. And in terms of protection, so it's great, it protects you. We have an expected rate of breakthrough cases, as they like to call it. As I mentioned at the top of the hour, 500,000 is predicted based on the numbers vaccinated so far. Those are normal. Most people should have mild symptoms. A few will end up in the hospital. Very, very, very few will die. And a lot more will die if they are not vaccinated. The second reason is to provide herd immunity and protect those in our society who cannot get the vaccine, who are immunocompromised. But perhaps the thing that's missed as well is really to end this pandemic, because as long as the virus is out there on its own, it's going to continue to mutate. That's what they do. That's Mother Nature. And they mutate at rates that are unpredictable because we never saw this before. They mutate at rates that can cause worse disease, milder disease, but it's the worst ones, that combination of higher contagiousness and higher mortality, that is the dreaded and feared outcome. And of course, it's preventing us from going back to our normal lives. It's preventing kids from going to school. It's preventing our economy from fully opening. And I think it's taking a mental toll on a generation of Americans. I'm tired of it. I'm tired of wearing a mask. I'm tired of social distancing. And I'm tired of talking about COVID. And there's no way other than to say there are multiple things we're going to need to do, and vaccination is one of them. I recall a public health person saying this to me. is that, about personal decision and religious exemptions. First of all, a lot of these mandates, I want to just say, people can get a religious exemption. But, I think it's important for us to remember that when the pandemic emerged, many people asked or prayed for a miracle. And quite frankly, God delivered 3. The results of these vaccines are out of this world, unbelievable. Measles has perhaps a similar rate of protection. Now, I was hesitant. My wife and I are physicians. I didn't want to be a guinea pig. I didn't want to go first. I was like, why do we have to take this? And by the time it rolled around, I will say that, my wife got picked first randomly, and she was, aha, I beat you to it. And what got us to that point is that we did our homework and we studied and realized that these mRNA technologies have been around since the 1990s. And since the 2003 SARS epidemic or pandemic, SARS-CoV-1 was the first virus, this is the second one, that people have been working on new formats of vaccine development. And this mRNA technology, which does not alter your DNA or anything like that, has been around since in this format since that period and been tested in cancer research like melanoma treatments for other heart conditions, heart disease, and has been published in things like The Lancet, which is one of our top journals. But again, those numbers were like 20s, 30s, not tens of thousands, and now millions of people. The main thing that really blocks vaccine development is money and access to people at risk. And in the COVID pandemic, both things were addressed. Governments threw billions of dollars, and the entire world was population at risk. So they were able to advance this in a way that we hadn't seen before, which is a good thing because we shouldn't be developing vaccines the way we've been doing it for 1902. That being said, it's still important to follow for potential risk and outcomes. And that's what we are doing and collecting data in these registries. And that is what information will lead to Pfizer's being fully approved in the near term, which is the main difference, larger population observation for a longer period of time. We know from previous vaccinations, all side effects are seen in the first couple of months and several more through the 6 months. I don't know of any vaccine. People used to worry about measles and encephalitis, inflammation, chronic inflammation of the brain, but that has been debunked. There's no vaccine that causes a new side effect years out post-vaccination. Now, is it theoretically possible? I suppose anything is possible, but we have to play the numbers game here because that's what life is about, right? And when you look at the side effect profile, it's out there, right? There are some risk of myocarditis in young people, inflammation of the heart, hasn't caused any deaths or anything. There's risk of clots, I'm sure people heard about, particularly with J&J. But again, those numbers are like 7 per million. You're more likely 1 in 300,000 or so to die in a car accident. But if 7 in a million is a deal breaker for you, then it's a deal breaker for you. But let's not distort the numbers. But what I hear about this is really fear and concern. And it is a fearful time and a concerning time. And we may not all have the luxury of waiting till we feel fully comfortable, as we heard earlier, because the virus is out there changing and the pandemic is not out there waiting. So I feel for everyone. It was a tough decision for me and my family and my extended family. I'm from the West Indies. My grandma boiled bush and gave it to me. So I didn't always thrive on, raised on Western tradition. I marry the two, but, it saves lives and that cannot be denied. And, it's bottom line, it saves lives.
Yeah, I definitely agree with you on that. It is a difficult conversation, and I know people are still going to have their beliefs and how they want to do business. And that's people's choice. But I just know, I think a couple of things that you said earlier, as the numbers in the hospital increase, sometimes not being able to have that access is also creating the number of people that are dying from this virus. And then the other thing is just, community. I'm on these calls, I'm on these different organizations, and we're getting hit the most. When you look at the Black and brown community, we seem to be the community that's being impacted the most when it comes to this COVID. And a lot of it is because our natural cultural styles of how we are with eating, our health, different things of that nature. So the encouragement part is definitely, if you're not doing the things that you already should be doing to take care of yourself health wise, making sure that you think about this, because a lot of times just the way we are, we have the highest diabetes, the highest blood pressure, the highest strokes, heart attacks, a lot of different things. We don't necessarily get the medical services that we need on a normal. So definitely just something to think about. But it seems to be in our community, especially, and it's really impacting us. So with that being said, the question is up. How do we get our community in the movement of trying to help be a part of ending this? I know there's been some financial incentives and things of that nature. I think a lot of people felt like there should have been more incentives. I even was one of those components. I saw the state of California doing those lotteries, and a lot of times in the Black and Brown community where we were impacted the most, we could have utilized some of that funding to help, put forward for people who are taking a shot that necessarily didn't get it. So what do you all think about that, and some of your ideas of thinking of how do we get our people to kind of get to that point? Because we don't want people waiting till the last minute and they're on that bed and then trying to figure out how do we compensate for that.
John, I know this is the question, but I just wanted to piggyback just one moment about the hospitalizations, because in the essence of time, I know we got a lot of questions, but as a clinician and a nurse, I just want to make it clear that the hospitalizations in these hospitals are deadly. The staffing that is required to take care of a patient on a ventilator is one nurse. So that means that you need one nurse just to take care of that one person. Typically, nursing out in California, they can take care of about maybe 4 to 5 patients max, one nurse. And so when we're talking about hospitalizations, and we're talking about people just coming in for just COVID related, we're going to be back where we were with the fact that not only do we don't have enough beds, when they speak to you guys about beds and space in the hospital, they're really talking about people to take care of these folks. Because one of the hospitals I'm at, we got space, we ain't got no bodies to take care of one patient on a vent all day, all night, requiring intervention, medication. It is a big deal to be hospitalized with COVID and requiring all of the interventions. And it is a scary thing. It's a scary thing. And imagine the exhaustion of the clinicians. We do get tired, just like Dr. John said, tired mentally, tired of COVID, tired of begging people. I'm telling you, inpatients charts, when they come in before they get ventilated, and this is from my own eyes, I didn't believe in the vaccine. I wish I would have did it. That is not just news. That is not just out there. Those things are really being said.
Yeah.
And unfortunately, they're real. I'm like, I'm telling you, one of my old classmates texted me, family member in my facility. We don't know how long they're going to be. It is serious. So I think we lead by example in the Black community. That's first and foremost. The more people, knowledge is power. I think that is great. Like seeing people like Dr. John, like this platform is so powerful because we lead by example. Like I shared earlier, I have family members that are still, I was just in my house earlier this morning talking with family members, just giving them information, sharing what I see, sharing what I know, providing them resources and sharing with them, this is what the reality is on this end. And I also asked them, what are your thoughts? What do you think the solution is? What do you think the answer to ending this is? Before we had vaccine, what was the answer? We were waiting on the vaccine.
Mm-hmm.
Vaccine and available to everyone besides the young folk. Now we're like, well, too fast.
Yeah, I mean, I think we do need to think about how we can increase vaccination rates, but really just understanding about COVID, your options of care, what you do while you're thinking about vaccination to protect yourself, all of these things. I come from the HIV field. It's about harm reduction and not to like force feed, condoms in everybody, but really talk about, well, if you're not going to use a condom, what are your other strategies, et cetera? Clearly, from a medical perspective, we know the vaccinations make a difference. It's not just about death. We don't talk enough about long COVID syndrome and other symptoms that people have it. And I have in-laws who have had COVID, youngish, late 40s, early 50s, working in the jail system, got COVID, now is on disability. It's not everyday story, but they talk about one in 3 people will have some form of long-term symptoms from COVID. And so that doesn't make the news because it's not sexy, and this is where the humility thing is, but it's out there. And those folks are struggling, and we'll have to deal with that after the pandemic. But, I think it's important for people to be vaccinated. I think it's important for people who work with community to be vaccinated because they spread it. We have had people been infected in the hospital from healthcare workers who were not vaccinated. So we know this happens. It happened here in the city. It's happened here at UCSF. It's really important that that they do get infected. And that's why places like UCSF are now doing mandated vaccinations. But how do we get vaccination rates up? I always tell folks it's important to have trusted messengers, not just going on these social media where you don't know who's behind a name. That image they put up may or may not be them. They may or may not have their own personal agenda. We were talking with folks doing some vaccines in the school, and there were some Caucasian, white, anti-vaccinator person giving out flyers in front of the school, the vaccine site. Where was this person 2 years ago in the community supporting that Black high school? They weren't around. But all of a sudden you're here in the neighborhood giving out these anti-vax information. Suddenly you care about the Black community so that don't get vaccinated. We all have to not be fooled on both sides of the conversation, right? So there are people who have agendas that are not aligned with what's best for the Black community. And so how do we know? Talk to people who got the vaccine. Talk to people who you trust, your doctor. If you trust your doctor, talk to your doctor, and if you don't, you probably need a new doctor. Like, you should be trusting your doctor at some point, and really get information and questions answered. We need to have vaccine information, testing, and vaccination simultaneously together, readily accessible, making it easy for people who are busy, who are working, who don't have time to take time off for something that they're on the fence about. So we got to get up in people's, be invited in, but we need to make it easy for folks to get the vaccination and have so shows like this, it makes a difference. And I think the city and government needs to provide the resources. And I know folks are like, well, the government's providing a lot of resources, they don't care about us. Well, that may be true. They probably care about themselves. Because again, when I think about HIV, what's the risk people are talking about with COVID? That COVID may become endemic, meaning it will never go away. It will stay because we may have missed that opportunity, okay? But with HIV is endemic in the Black community compared to other diseases, right? We're the only community for which HIV is one of the top 10 killers. Okay, and we don't talk about it a lot, but it is. This is my field, right? But they don't care, and they don't spend money because they have to consent to have sex or share a needle to get HIV. But they care about COVID because if COVID is endemic in minority communities, it's still going to spread to them. That's why they care. So to answer the question in the chat, that is why they care. They may not be loving up on us, but they care because they worried about themselves as much as they care about if they, So let's be real here, okay?
I think that's a very, very good point. And to Nicole's point, I definitely want to give a huge shout out to all our medical professionals, our doctors, our nurses, our LVNs, our custodians. We're not just going to highlight all of the people that's in these hospitals. I'm at UCSF. I see the work. And a lot of these nurses are working 12, 14, 16 hours, coming back, as these numbers increase in the hospital setting. Definitely, I just want to give a salute to them because it is a lot of work. It is very draining. I know the mental fatigue that also happens, but I also want to acknowledge all of the medical staff in these facilities, Kaiser, Bum, all of them, because these environmental workers sometimes get overlooked. and they have to do some of the work that's in those difficult areas, making sure that the place stay clean, making sure that we're doing our part to make sure that we stop the spread. So thank you, and want to give a great shout out to all of our medical professionals, no matter where you at on that realm, because it is a lot. The staff is sometimes is short, and they do an amazing job to make things happen for a community. But Dr. John, I think you said a great point. When we talk about this vaccination versus the HIV in our community, and a lot of it is messaging, and a lot of times, we said the condom thing, it just kind of made me think back to a lot of it is from drug use. In San Francisco, we are hit the hardest when we talk about the opiate use and heroin use, shooting needles and different things of that nature is a big spread of HIV in our community. But when we talk about COVID, I think that is a very good point. Any other time, sometimes we're not really looked upon and looking for solutions, but because COVID can impact anywhere, that was one thing that we learned from this. Even if you're a millionaire or a 1%er, you still can be impacted. So I think that is where a lot of the shift and financial shift and making sure that people are connected, are doing the right things. But I think as government, as well as these elected officials, we also have to remember and keep that in mind when we're looking at all of the different things that impact our communities. When we talk about mental health, because there's a lot of money that's been put into the vaccination and a lot of things that they allowed happen that typically don't happen. I remember like when the COVID really started moving around, the governor here also uplifted, some of the colleges to allow the students to have less requirements to get in. And I think we need to have that same look when we're looking at mental health and different things that impact our communities as well, because I think that is very important. But yeah, at this point, anybody could get it. And I think that's why the focus is to make sure that everybody is vaccinated or going to get vaccinated and things of that nature. And we just got to continue that movement. And it is outreach. It is a financial part of this to get that messaging out, the right messaging out, and trying to support the community. And definitely it takes a lot. We're trying to do our part. People have the right to make their decision. We here at both sides of the conversation, we're not advocating for people to do it one way or the other way. But again, I am fully vaccinated. And I am one of those people that can get that testimony that, I don't have some of these things that people said happen on the internet and different things of that nature. And I know a lot of people always kind of equate to the flu and different things of that nature. But I remember there was a time where people was afraid to take the flu because a few people was paralyzed from the flu. And then people was like, I don't want to take the flu because you could get paralyzed and things of that nature. And we just have to also understand as our human DNA, there are some things that will affect some people, and it's just not all people. And, we'll see.
I was going to say that too. Say that too. I'm glad you brought that up, John.
Go ahead.
Things are different for different people. People respond differently to the side effects of getting the vaccine. And I think just being aware of that, I was just sharing that with a family member of mine. When I got my vaccine, I had no side effects as far as the malaise or anything like that. But it's not a cookie cutter thing. You may get headache, you may get a malaise, but I'm telling you one thing, if you see somebody and you walk into, or you guys can probably YouTube it, watch somebody get ventilated, watch somebody get put on a ventilator. It is not pleasant. And sadly, like someone put in the chat, yeah, there are some risks behind that. And that's what this is about. This is about preventing going to that, because we know as clinicians the risk. Just like any procedure, they'll tell you in the hospital, you get this heart surgery, this happen, they tell you this, but you'll do it if it means saving your life. You'll do it. You'll say, well, let me get the surgery then if it's going to help. You may not know. You don't know. And with the vaccination, if it can prevent me getting in the hospital, being able to not support my family, and let's be clear, I don't know about UCSF, and you guys can correct me on that, but as far as I know, somebody put in the comments about the firing or clinical staff mandating. I know at a facility that I am at, you can not have the vaccine, but you will have to be tested twice a week. But some folks, you don't want to do that either. As a healthcare professional, a You know, like you said, the janitor, we're going in and out of these rooms. You have your vaccine or you get tested twice a week. Well, they're not saying you're gonna get fired, but you have to make a decision. And I think people are getting, especially with our generation, as far as this current climate, we don't like to be told nothing. We don't want to be told. We get so, I don't want to do it. I want my freedom. I want to be able, but like the physician said earlier, what are you doing on your, if you don't want to get the vaccine, okay, fine. What are you doing then to prevent the spread of this pandemic? What are you doing? Because I live in Solano County, and these folks is out here, no mask, walking in the store. They just really, people, no, I don't want to get the vaccine. No, I don't want to get the wear the mask. No, I don't want to do anything. I just say to people, what are you doing? You don't want to get the vaccine. I'm okay with that. But what are you doing? Because we are in this together, whether you like it or not. We're all in this together. It's going to affect somebody that you know, if it hasn't already affected somebody that you know, for sure.
Man,
It's that big. 4.21 million cases in the US, 64,000 people dead behind COVID, whether people want to believe the numbers or not. You want numbers? This is it. 4.21 million.
Yeah, I think one of the things that I wanted to say, and I'm glad you said that, whether you want to get vaccinated or not, one of the issues that I have that's a big issue for me is people that are getting tested and found positive with COVID are still going out partying and different things. Like I'm like, come on, people, like at least have the decency. If you test positive, don't go spreading it to everybody else. You know what I mean? And that's just one of the things I wanted to put out there, whether you agree or don't agree today or whatever. If you test positive, stay home. Like, I am tired of seeing people who test positive out in the community, going to community functions, out at the grocery store. Like, at least have enough compassion and humility for others, whether you agree or disagree, to at least stay home and respect the community. And that's one of the biggest asks that I had, that I wanted to put out today. Yeah. You know, just please make sure you stay home. If you do go tested and you find out that you're positive, please stay home. Don't infect other people in our community. At least, if nothing else, can you all do that today? That's what I really wanted to get out, because I see so many people out there.
Get tested. Right. You know, make sure you get tested, particularly if there's any symptoms. You know, Nicole mentioned in the workplace, people are being asked to get tested twice a week. I mean, I think we have to understand, you know, the vaccination for unvaccinated people, they do pose a risk for propagating or extending this pandemic. It's a risk for everybody because it allows the virus to continue to change in the wild. That's the bottom line, and to eventually potentially escape any protection from the current vaccines, and more importantly, to cause more damage, more death, more long-term COVID syndromes, etc. But the other piece, is that people who are vaccinated are unlikely to get or have a low probability, but they do sometimes get infected. And one study, which I do think had some issues with it, had shown that instead of 1 in 3, 33% or so of folks getting long COVID, they were saying 19% of people who were vaccinated and got COVID. Again, you're less likely to have that happen, but if it does happen, you could develop long COVID syndrome. So it's not a zero game. It is a complex system, as most biological entities and things are. And so it's really important just to take a step back and say, what is the pros and cons for me as a person, for my aunties and grannies that I socialize with, for the kids that I socialize with, for the community that I am a part of? What does it mean? What is the benefit? And what's the risk? Okay, what's the positives? What's the negatives? And who do I know that I can put my hands on and talk to, who actually is a health person that I trust, is actually someone who got the vaccine? This is the first time that I see people really listening to politicians and random people around them for their health. Really? You have a heart attack? Are you going to ask your congressman what to do? No. You know, are you really? But this, and all this tells me is that people are scared, and rightfully and understandably so. People are scared. We are all scared. there is a path forward, whether we choose to do it or not. That is up to each of us, right? But there is a path, whether it's vaccination, masking, and staying home. But people, again, rock, meet hard place, but that's where we are. And, we're all adults. We have to make adult decisions.
I think that's a great point, because I'm definitely not going to ask the mechanic to go bake a cookie, and I'm not going to ask my baker to go work on my car. Ask the people that has the information. I think that's a great, segue into this. And I know the politicians make the decision if we're going to close down. But just from Nicole's perspective with data and you being in the hospital, we know what causes to go in shelter in place before. So it doesn't take a rocket scientist to figure out if we continue to increase these numbers, there's a high percentage chance that we'll be going back into shelter in place. Do you agree with that, Nicole, doctor, or am I alluding to something that's not true?
What I foresee actually is what's happening right now. The vaccinations kind of requiring for you to do certain things, which kind of answers the question, right? Because if you need a vaccine now in the city to go eat and go to these concerts, people aren't going to be able to go, certain folks. And so it's a little bit like this answering the same question. Do I foresee them locking down and us going back to like a full shelter in place? I personally don't, but I see more and more areas being restricted of the vaccination. Like San Francisco County is not even allowing you to have a negative test result. You have to have a vaccine. Me and Mike, Brittany said earlier, next week, me and my girlfriends were going to go to Maestro's and celebrate a birthday with someone. And guess what? Some folks that ain't vaccinated, you can't go. And so I think that's a way, unfortunately, of people being out in public and potentially, because that's what shelter in place prevents, people being out in public spreading the virus. So that's just my opinion. But again, it's not in our hands.
Now, Brittany, because I don't know, I know that we have the vaccination in place. I know you said that they was asking y'all. I don't really eat out that much anyway, so I like cooking my own food. But are they actually asking you at the door? Because I've been to a couple places, a couple restaurants, and they have it
8:20.
Yeah, I've had both experiences. So I've gone to a restaurant with a friend where I did not have my card and they had their card, and we had to sit in the unvaccinated section, which was like outside where it was windy and dusty. So I didn't like that. And then we went to Voodoo Love yesterday. And I have my card. My friend has not been vaccinated and did not have any proof of testing. And she got stopped at the door. And we also can't assume that just because a restaurant has an outside seating area, that that's going to be the unvaccinated section, or that they're even going to be using that section, because I was like trying to pick out places that had outdoor seating. So we can't even go with that assumption. So, people just have to prepare just for that. My friend is from Georgia, so they definitely move differently in Georgia. So she wasn't prepared for that. And so here she is, back in San Francisco, and no, San Francisco moves way differently now. Like, you can't go into these restaurants. And even if you think you know the people and they think you're cool with them, no, they're not going to let you in. It's in their eyes.
Well, I will say the good news is, for the most part, San Francisco has been very blessed, right? We have followed the science. Our public health officials have given really good guidance. I don't know if a lockdown, I agree, it's not the ideal thing to do that again. I agree with Nicole. Where we are is probably the way people are going to stay for a while and see, but I don't think lockdown's off the table, but no one wants to go back to it if at all possible. I think economically and for other reasons as well. I think mandates have been around since 1902, when they had smallpox, and smallpox vaccines came in the early 1900s. It's the basis by which schools are allowed to mandate vaccinations of kids. The Supreme Court has upheld that consistently, and we have Recently, that newest of the Supreme Court's Amy Barrett Conan, who was considered one of the most conservative ones, just point blank turned away a request from her district to upend or overturn a state mandated vaccine requirement. So mandates are legal, constitutional. They've been done before. It's required for like schools, and we'll see them rolling out more and more, particularly after the full FDA approval. And by the way, the vaccines are FDA approved. The full approval just means more data. And we'll see that coming up in September, and we'll see more of it. And I do agree that sometimes this can sound a little somber, but we are lucky. We have choice, and we have done incredibly well and navigated this so well. We have to be vigilant, and we have to understand that we want to come out on a Juneteenth in Gilman Park, have a good time, and not be like having an outbreak of COVID after that, right? So this is where we are. I just got my parents, who were retired in the West Indies, Trinidad, up to the States. They're like begging for Pfizer and Moderna and can't get it. They're having an outbreak of COVID and can't get what we get. They get the Sinopharm Chinese vaccine. We are very fortunate to have choice, and that's something to celebrate and be happy about. So yes, these are tough decisions, but we are in a land of riches, and we should be. Gratitude is always a good thing. So I do want to bring us to a space of gratitude, even if we have different opinions. We do have wonderful treatments. They're not perfect. We do, and they will be overwhelmed if too many people come into the hospital, as Nicole and I have mentioned. But we are, and I will just end with the allegory of this comment of the guy there's a flood and he's on his roof praying for a miracle. And if you believe in this thing, the allegory I'm going to tell, right? And a boat comes and he says, no, God's going to save me and send me a miracle. Another boat comes, no, third boat comes. Eventually he drowns, he gets to the pearly gate and says, God, I've been devout all my life and I prayed for a miracle. Why didn't you send me? Because I did, I sent you 3. So, we have to also keep in mind that we live in a land of riches, and that's a blessing, whether you're religious or not, that's a blessing. And I'm grateful that we have options and that we can have this open dialogue and reflect on how to take care of ourselves, our families, our loved ones, and our community. And you don't have to make any changes today, but I hope that we're getting closer to a space where we're putting rhetoric behind us and we're really supporting each other in this decision and feeling, understanding the data in the truest sense and going to the experts, not the politicians, not the this or the that, but really the people who do this for a living that you trust to get good data.
I do want to note that Dr. John was making an analogy that there, in fact, has not been an outbreak from gatherings at Gilman Park.
Yeah,
so
no.
I just want to say that we kicked it on Juneteenth. There was no outbreaks.
I said I want to be able to do that.
Right, but you said that you want people to be able to come together and there not be an outbreak.
Yes.
It has never been an outbreak.
No, there is not been
an outbreak. I mean, at Gilman Park. Yeah.
In the future, I want to be able to go and get together and not worry about it. And so absolutely.
Yeah.
Thank you for clarifying that.
And to the people out there, there's some people that's being a little rude and disrespectful in the comments. It is me that's putting you all in timeout. I'm not going to let you bring the smoke to Nico. I see they trying to take shots, but this is my not only a panelist today, a friend, and I know her passion about her work in the community. And again, for all of you watching on YouTube, if you have not seen our community standards, please go and read them. We're not going to tolerate none of that here. Both sides of the conversation is here to have both sides of the conversation. We don't play the party game of Democrat or Republican. It's a conversation. We're not over here trying to skew information one way. This is not about a Democratic show, Republican show. It's none of that. All we hear is having a conversation for our community. Please be respectful of that. So I am the one you messaging me. I'm the one that put you in timeout. I am trying not to block people because I'm always about letting people have their voice, whether I agree or disagree. It's not about that. It's about everybody having their perspective heard. Doesn't mean that it's right. Doesn't mean I have to take that prescription, but please be respectful of our platform and our panelists. And I'll ask you all again, I don't want to block people because that's not how I am. I don't get down like that. I like everybody, no matter what party lines, who you believe in, what you believe in, to have your say, but please do it respectfully. And we could agree to disagree, and that's fine. But with that being said, one of the questions that came up about the Delta variant, a lot of community has concerns because we went from the COVID to Delta. Do you all think, Nicole or Dr. John, that there could be other variants that come out of this strand that could be even more deadly? Will people have to take a different vaccination or shot if something else comes out? And then also, as we start approaching the flu season, a big fear in the community too is our families being impacted, right? Because if someone has flu-like symptoms or flu symptoms, that's not COVID. And we have a lot of single families in our community, right? Sometimes, like Brittany said, one family member is the breadwinner for the family, right? Mm-hmm. And these schools are kind of the people that's overseeing our children in the school. And if they come to school with flu symptoms and they mistake it or say it's COVID, or if COVID happens, our families are being impacted. How are we going to differentiate, the regular flu versus the COVID? Because I know a lot of times there's a lot of mixture with that. And sometimes those discriminatory practices happen where people, I don't want to be around and you got COVID because you coughing, or you might just have the regular flu. But how do you see that happening moving forward? Or just from your perspective, what do you think about that? I think that's a big concern from our community, especially for our single family homes. If they're impacted by, a positive test or a different variant and they already took the vaccination, worried about being able to still be able to provide for the family, especially if there's another variant that comes out of this.
So I'll just quickly talk about the symptoms as far as flu versus COVID. One interesting thing that COVID has brought out is that people work sick and they shouldn't. People go to school sick and they shouldn't. And with COVID, it has made us more aware that if we don't feel good, we shouldn't be going nowhere. And we have got to get tested. And so it's sad because you will hear people share, oh, I had a headache and now I have COVID. You know what I mean? So the symptoms, there is a nice little bubble of symptoms for COVID. But again, going back, I know I've said it before, it's such a phenomenon that if you're exposed, if you were someone was exposed that was by you, if you don't feel, I tell folks all the time, because I work with the workplaces of employers in the city, and I tell them, if your employee calls you and says, I don't feel good, they need to stay home and they need to get tested. And anybody that was in contact with them needs to get tested, because this is just where we're at right now. This is just where we're at. And flu is one of those things. I know last year, flu season wasn't really that bad from the hospital standpoint, simply because people were isolated. People were more hyper vigilant. People were inside. People are doing things that they were not doing before based on hygiene, sadly. People are having their groceries sit outside for a day before they bring them in, clothes and this and that. And so I don't know about flu being highly impacted. I do know people are symptomatic. Also with allergies, people have allergies that they thought, oh, I'm having allergies, and now you had COVID. So fortunate in the city. Again, I live in Solano County, but working for the DPH, it's so many resources to go get tested. People are coming to the job to test. People are going to places to get tested. Everything is so readily accessible, in my opinion, based on other counties. Again, I can't speak for like Contra Costa or Alameda, but as far as Solano and San Francisco, I think that people just need to really be hyper vigilant about being tested. And if you don't feel good, you need to stay home.
Right. I just want to ask you a question. I think that's a good thing you brought up about the people and sick and things of that nature. And I hope some of our HR people out there, some of our corporations understand now that we're talking about, because so many times these corporations have policies in place that actually discipline employees for calling in sick. Hopefully globally, we could really like start looking at this. When people are sick, I think you're 100% right, whether it's the flu or just sick. How do we empower our employees, our people of work, when they are sick, to stay home? You know, I think that's very, very important that you said that. But go ahead, Dr.
Yeah, no, I mean, I think, John, you raised a very important point. You know, we knew early on that some people were avoiding testing for the very reason that you raised, that they're the single breadwinner or the main breadwinner. And if they were to test positive, that would mean they would have to spend some time at home and decrease the financial intake. So I think there will need to be continued policy support for folks like that. How do we help folks bridge that? I think obviously being vaccinated, and I know again we're talking pros and cons here, but this is a pro, right? So that if you are vaccinated, you are, the risk of that being COVID is decreased, right? As opposed to the flu or the common cold. And so an antigen test that comes back negative can be, trusted in those settings. So whether or not they'll be able to do some rapid testing in those settings, it may be a possibility. But I think a lot of it will depend on what happens in the flu season. A lot of it will depend on penetration of vaccination and the success of some of these mandates, not only in terms of getting vaccinated, but also controlling who's coming into these congregate settings. I do think, I'll stop there. I think there's a lot to unpack there. That could be a whole hour conversation. It's a lot to unpack there, and it really puts people in a bind. And it's one of the negative effects of the pandemic beyond just the physical. And so there are multiple reasons. And as you point out, that can disproportionately impact certain communities more than others.
Definitely. Well, with that being said, Dr. Malcolm, we are 15 minutes away from ending today's segment. At 4:00, we want to be respectful to you all time. And Ms. Brittany, thank you all for definitely, coming on today. This is not the last conversation we're going to have it. As we start getting into the winter months, we'll continue to try to have these conversations and look at the numbers. Definitely, you all have an opportunity and access to our platform. If there's new information and things that's coming out, we would love to have you guys do an educational presentation as well. Have another conversation for our community, because I know they're still hesitant in our community. And I just think that, as things start to roll out and as things happen, hopefully people will be able to make some better informed decisions and thinking about it as it starts to impact people close to us. Like, I've had 3 or 4 people, 2 of them died from COVID just recently from Delta. So I understand the seriousness of it. And I know people have their political things and different feelings that they have about it. But as community, we have to, like Nicole said earlier, we have to come up with something to stop this. So right now, if you are one of those people out there that's decided not to take the vaccination, that's your choice. I'm never going to push nothing on anybody. What the government does here in the United States, I can't control that. But I do ask community, if you do test positive, please do your part and stay home, isolate, and do the things that you need to not spread it out to the people of the community. I think that's just a fair ask. And, do your part to wear a mask, social distance, and things of that nature until we come with anything that's going to show us something better. Right now, those things have been a proven fact to slowing down the spread. So we definitely want to let that be known and out there. But Brittany, before I move on and let everybody, I want to let Dr. John and Nicole give some parting words to community as we start closing out this segment. But I wanted to ask you, because I know you said that your friend wasn't vaccinated. And I just wanted to ask you, being vaccinated, being around somebody unvaccinated, how did it make you feel? Was there, I just want to know, because sometimes these questions we don't never talk about. Like, when I first was unvaccinated, people was acting funny with me, and then I got vaccinated. So, like, what was I know that's your friend, but did you feel some kind of way, or
that really is a good question, because there's so many questions and uncertainty out around the vaccine now. And and she was wearing a mask around me because she felt like I could have been a carrier and infected her. And I really didn't feel scared, being around her. Being vaccinated, I do feel a sheet of protection. And so I do kind of feel a little invincible, and I kind of move like I'm invincible as well. So, I didn't feel, but it really triggered me to think like, well, dang, she's sitting here thinking like I'm the risk, like I'm the one that could get her sick, when she was the one that was unvaccinated. And so, there's different dynamics that go with that. And I know that I just need to continue to just keep my mind open and, keep an open mind, because things are about to change. I mean, I saw somebody in the comments talking about medical segregation. And I mean, we were so used to being segregated in a different kind of way. So to bring up medical segregation, that's a whole nother, conversation. And so I know that things are going to change. That I feel, and that I can see. It's just the direction of, how we're going to go, but it's going to be different, I feel, moving forward.
Definitely. Thank you. I just had to know that. But Dr. Malcolm, real quick before I pass it around to Nicole and to close this out. I missed the town hall meeting this Friday for UCSF, and it was talking about the COVID. I guess, how do I ask this question? So one of the questions that I get a lot from people in our community, people of color, has been, people feel that once you take the vaccination, you're more susceptible to catch COVID. Like the vaccination that they're putting in you, now you're like the magnet for catching it. Because I know we had a little outbreak at UCSF. A lot of the staff who were vaccinated did test positive. I know people in the community who did take the vaccination end up testing positive. And then in the community, kind of turned to like, see, you took that vaccination and now you're getting it because it's like a magnet. It's bringing it to you. Can you kind of just talk to that? Or did they talk about that in the meeting? Because I missed it. But can you talk to that? Because I think that's some more negative messaging that might go out to our community, because now people feel like, because there have been a spike of people that are vaccinated, have tested positive, or contracted the Delta. Can you speak to that in any kind of way? However, I mean,
I think we talked about this earlier. It's just so much is going around, and right now, the more that it's going around, that umbrella, that vaccine umbrella, is not going to necessarily be sufficient by itself. It could have been, and maybe it will be again. But when you have a downpour, so many infections happening, the majority of them are happening in unvaccinated individuals, but you're going to be at risk if you're vaccinated. It's a low risk, less than 1%, but you're still going to be potentially, and that's to be expected based on the numbers. But you're not going to end up, most likely, it's a very rare occurrence, you'll end up in the hospital or dying. So, really, the reason is not because you got vaccinated. The reason is because so many people are unvaccinated. And that's the reality. And I think people don't want to take ownership of that decision. That's not to say that decision is right or wrong, but, I weighed the pros and cons, and I understand I might be a carrier or put other people at risk, but this is the right decision for me. Then own that, instead of trying to punt it off and say it's the vaccine that's causing it. No. It is, we make decisions and we weigh the pros and cons. But it's not because of the vaccine, right? The vaccine protects you. So how does the vaccine work? The mRNA vaccines, right? They are instructions, like, everyone knows about DNA. It's inside yourself, the book of life, the code of life. It tells you, has all the instructions of what to make. And it's so precious. It's got to sit in that central library, the nucleus. But you got to tell the factory workers what to make, right? And I say this because there's something in the chat, so I'll get to my point real quick. But basically, you got to get the instructions. What are we going to make today? We're going to make liver cells. So you go to page 27, you go old school, pen and paper, you write down the instructions on how to make a liver cell on a piece of paper. And you take that paper out of the library to the factory and say, here, this is what we're going to make. That sheet of paper is the mRNA that people are getting in their vaccines, okay? And it's a flimsy sheet of paper. You pass it around, you pass it around, you pass it around. By the end of the day, it's all tattered and torn, which is a good thing, because you don't want that vaccine, or that mRNA rather, around indefinitely, because you don't want to make too many liver cells. And so the body has its own system of eliminating mRNA. In the humans, it's anywhere from 3 to 5 days they last, okay? And so that's how long these vaccines last in your system, is that you have these mRNA, it's covered by 4 salts and 4 oils, no fetal tissue, because that's something people have talked about. And that protects it, it gets to the cell, you make the spike protein, you put it on the surface of your cell, you have nice military and nice people, nice police, not necessarily what we see all the time here in the States. They're coming around, checking out the house, checking out the cell, see something out of line. Whoa, we got to get prepared for an attack. The next time your body sees the virus, it's ready for that invasion, and it prevents it from causing severe disease and death. That's how this vaccine works. It does not promote infection. It actually does the opposite. It protects you from the death and so forth. It's no live vaccine here, so it can't cause the disease in you. It doesn't make the disease happen. We don't give it to people when they're in the hospital infected in case you have a reaction to it. It's not going to help you, number one, and you may have a reaction to it while your body is in disarray from the infection. We usually want people to wait about 3 months after they're infected to get it. You can sometimes give it earlier as long as they're not in the middle of a disease, an active disease. So that's sort of how that works. It protects you. It doesn't cause it. You're getting it because other people who are not vaccinated are carriers or a population that is allowing the virus to mutate, and that is where the vaccines can become less protective. I hope that answered the question.
Yeah, that's pretty good. And then I just hope that, when we have some further conversation, I just want to know where they simultaneously working on some kind of medication as well. I know right now is if you get tested positive, you have to quarantine, stay in the house, rest, drink water. But how close are they to like coming up with some medication or some?
If you test positive, you should talk to your health care provider, because if you're at risk, there are like certain antibodies like Donald Trump got that you can get to prevent yourself from progressing. And in fact, there is even a high risk exposure for people who are extremely high risk. You can do preventative interventions now. So it's all about communication. Find a health provider that you trust and communicate. Things are changing rapidly, period. For prevention and treatment, things are changing rapidly.
I think that's very important, especially in our Black and Brown community. Have to be transparent with our medical providers. I went to an appointment with somebody and they like not even telling the truth. I'm like, come on, man, you got to. These are the people that's gonna help you. But we have to be more transparent. I know in our community, when it comes to the medical field and doctors, because of the taboo and some of the things, sometimes we as community are not transparent with our doctors. Remember that they are there to give us the help. They are the professionals. We have to be open and honest about these conversations. And I mean, I've been in these appointments. I've been a caretaker for people, and people they smoking weed and they don't want to tell their doctor they smoking weed. But it's like, if you don't tell me this, I need to make sure I give you the right thing. And I think sometimes it's just sometimes the pride in our community. I don't know why, but we have to be honest. These people are not the police. They're not here to judge us. They are here to give us the right things that we need, or make sure that we get the right things that we need if we are doing things that could impact that. So just thank you all for coming.
And I just want to say, for the record, I am a terrible patient. I hate needles. I don't see my primary care doctor nearly enough. My wife is like, you got to get a new one. So just because I'm a doctor doesn't mean I'm the best patient. I was, I raised like everybody else, kind of like, I'll be fine. So, but the reality is I see what I see, and I know what I know from the science and the data, and not just about this, but, for the health field. And I do the best and follow that as best I can. So I encourage people. I get it, where people are coming from. Trust me, I'm the biggest crybaby for a needle, but I am. I don't like it. And I'm not lying. I don't like it. And so
I've seen those kind of patients.
Well, men always faint more than women. Men always faint more. We're the worst.
Men are the worst.
We're the worst. We're the worst. So,
hey, well, you know what, doctor? I appreciate your transparency, your honesty, because sometimes we have to do it. I always tell people, for me, I've experienced it. Sometimes the most unfit physical trainer sometimes is the best trainer. Just because they got a six-pack doesn't mean that they're the best trainer. I had some people that I'm like, how are you telling me?
I like that analogy, John. I don't know if I'm loving that analogy. I'm not loving that analogy.
Oh, well, that is good. Definitely people tap into your folks. But with that being said, I'm going to give Nicole an opportunity, then you, Doctor, and then Brittany, some closing words to community so we can close out today's show. I think it's always important just to recap and just kind of give some information to encourage our community. So I'll let Nicole go ahead and start out, and then we'll just move around.
Thank you again. I just want to share with everyone a couple things. As go back to the vaccine, just remember that you are not fully vaccinated until 14 days after your second dose of the vaccine. Again, that's where a little bit of some of this misinformation is coming from also. You cannot get your second shot, go out there raw dogging it with no mask and hanging out with everybody. You can't do that. 14 days after your second dose. And I know that sometimes, and it's our responsibility as vaccine administrators to remind you of that. And because there are a lot of people giving out vaccines just for your own education, do not go out there thinking, hey, I can do whatever I want. Second thing is, numbers are going to change because restrictions and guidance changes, right? So you got now people, what, 2 months ago, take off your mask, no mask to enter the store. You got your unvaccinated, your vaccinated, all in one area. So you're going to have this little melting pot of people testing positive, people being exposed. And so there's where your numbers are skewed. So when you look at data, look at the variables of data, because data without the vaccine is going to look different from data with the vaccine, with lockdown, without lockdown, with homeschooling, with not school. You're going to have to look at all of that. So it's totally not black and white. The last thing before I end, I just want to thank you guys for putting in the chat, but now with some of the mandates, you do have to have your little trusty vaccination card that some of y'all probably, got wet, threw it in the garbage, don't know where it's at. You can get your digital vaccination card. We'll show y'all mine, but screen is what I put it up there. It's so quick, like less than 3 minutes to do, and it's like a little QR. So now, if you want to go to the Giants game, you ain't got to worry if you left the card at home. Boom, you got it on your phone, and they're gonna scan it, and you're gonna be able to go on in that thing. So get your digital vaccine card. My son, so he got his first shot in California, and then he got a second shot in Reno, and he still was able to get his digital vaccine card. So get your vaccination digital card so you're not scrounging around like Brittany. You don't want to get caught being outside of the restaurant. You can't enjoy your steak because you ain't got your card. So I just want to let everybody know. When I go out to the community, I always work with people. They get it on their phone and they're super excited. And so thank you again, John and Brittany, both sides of the conversation. These conversations is what's going to get us back to where we're going to have some fun, because people are going to listen to these. They're going to see people that look like you and me, and they're going to be like, well, maybe I'll think about it, or maybe I'll do better, or maybe I will figure out what I'm going to do to stop this thing. If that means sharing with my unvaccinated, unmasked family member that keeps, like John said, don't come over here to the cookout when you're sick. You know better than that. Stay at home, please and thank you. So maybe this will generate those conversations outside of just, let me get your arm, let me get you a vaccine. Just conversation. Thank you.
Hey, thank you again, Nicole, for always being real, authentic, and transparent, and always supporting both sides of the conversation. We appreciate your leadership in the community.
Thank you for having my back in the chat.
Oh, I know. I got your back. I ain't gonna let them do my people like that. But I really appreciate you and always support you, and thank you for always supporting us. And I see a lot of your analogies, so I know you're gonna be at the relationship conversation because I see it coming. But thank you again, and just thank you for looking out for our people, making sure that the correct information is going out. And I know you work hard to make sure our people get the right information and support that they need. You always advocating for us, so thank you for your leadership as well. With that being said, Dr. Malcolm, you want to go ahead and give your final words for the day?
Yeah, Nicole hit all the salient, important points about the data and the information, and I thought it was so spot on. Thank you, Nicole. That was fantastic. Thank you. So I'm going to take a slightly different route, which is to say a couple of things that we heard in the community, concerns about fetal tissue, and I mentioned earlier that there aren't any. J&J is packaged in an adenovirus. We're not doing a lot of J&J these days, I suppose, but for those folks remember that they did have to passage it through a fetal cell line, which is like thousands of cell lines away from a sample that was obtained from a fetus. And the Pope and the Holy See, if you're a Catholic, came out and supports the Pfizer and Moderna vaccines, but not the J&J. So just want to be transparent about that, because we heard a lot about that. And I think a big thing that young people have talked about is infertility. And that seems to have stretched from the initial concern that the spike protein, which is the target for most of these vaccines, that was an attachment type protein, might mirror the attachment proteins in the placenta that allows your fetus to attach to the uterus. Well, they're very different. There's no cross-reactivity between them. That was a concern about infertility potential in women, but now somehow it's leapt into guys and everybody. There's no fertility issues. Women have gotten pregnant on this vaccine and have done just fine. And in fact, pregnancy increases your risk of doing worse with COVID and potentially having to deliver an early baby. So I just want to debunk that because it's important. And it really gets to my other question. And of course, people talk about the chip. And of course, if you have a smartphone, you've been chipped. We'll talk about that another time, but with your name on it, right? But I think all of this speaks to what I said earlier about people struggling with these tough decisions. And I'll end with an analogy that Brittany has heard me use before, that some people laugh at, but some people hope no one is offended. But it's about Viagra, which is not a vaccine, I understand, but it's important, right? So when Viagra came out, just about every male patient asked me for it, for themselves or at the insistence of their partner. And in fact, family members asked me for it. And I asked this question: how many of those men asked me about the clinical studies or the side effects of that new drug? And the answer is what you would expect: zero, right? So that's not a shock to anybody, right? But what did that really tell me? What does that teach me? Well, the perceived value of Viagra is so high for people who seek it. Sex and intimacy is something you can very easily understand, right? That they trusted that the government had done the necessary approvals. And, in fact, Viagra doesn't work for everybody. And if you have heart disease and you're on nitrates, you can end up in the ER or die. And people have died taking Viagra. But that's not what people saw. They saw the potential benefit. And the second thing, half of them was like, my buddy took it. It worked for him. So I want to try it. So two things. As you think about this, what is the perceived or possible value to you, your family, your loved ones, your aunties, grannies, your community, to protect yourself from COVID, to end this pandemic from changing, as it has shown that it will do and will continue to do? And if not getting vaccinated, at least protect yourself in the ways that we shared today, and not coming out without the mask and without being tested on a regular basis.
Wow.
And who can you talk to? Not what you see on the internet, but who can you talk to that you actually lay your hands on? Know this person, know them well. Whether it's your physician, your nurse, your health person, and non-health people who've gotten vaccinated. And not a rumor on the internet or one case out of a million. Because you're vaccinating the entire world. You're going to see everything, right? So people love to pull out those rare examples. What we got to do is talk to the people you know. So please do those two things.
Hey, I just want to say thank you again, Dr. Malcolm, for coming on. You're the second UCSF doctor to be on. I'm sure I'll run across you up there on campus or in the community. Definitely here at both sides of the conversation. We will continue to try to engage with UCSF and different organizations like UCSF to come on, because there's a lot of research and things that they're doing definitely impacts the Black and brown community. So we'll definitely keep pushing to get more of these conversations happening, especially when we talk about mental health, trying to connect with some of the mental health, Black mental health professionals up there as well to continue those conversations. And I'm just glad that you're here. Sometimes it takes the community of UCSF to see one of their own on the platform, and they might get a little bit more encouraged to come help the community. We know that UCSF is making a big push to really engage in the Black and brown community across San Francisco and beyond. So thank you for coming on, giving us your time and being real and just having this difficult conversation. This is a triggering conversation. I know people get passionate about it. So thank you for just coming on.
Passion is good.
Yeah.
Thank you, John. Thank you, Brittany. So nice to meet you, Nicole. And thank everyone out there who listened today for all your questions and input, and even the heated passion. We love ourselves, we love our community, and that's all good.
All right. Thank you very much. Ms. Brittany, go ahead. You're pretty good at wrapping these things up. Go ahead and give me what you got, Brittany.
All right. Well, I would like to thank the panelists again for coming out. They pretty much said everything in their wrap-ups. At the end of each show, I like to do like a call of action and just encourage organizations and community members to step up and take accountability for what goes on in the community and what can they do to play their part. And so in closing, I have a couple of call to actions. The first one is for the community, and that's just to continue to do your research. Everyone has a choice. Continue to do your research and just be open to hearing, the medical science behind the vaccine and what we can do collectively to continue to protect our community. To the medical community, my call of action is to continue to be present in the community. Dr. John, you said earlier that there was a white anti-vaxxer standing in front of the schools passing out flyers, but we also really have not seen the medical community that active in the community either. So we want to see our medical community, our health influencers standing out on the corners, passing out flyers, getting that education out there. Sometimes, a platform like this is good, a Q&A platform is good, but that face-to-face interaction, that presence in the community, whatever needs to be done to continue to build the trust and a medical presence in our community is very much needed right now. So we need that same gumption as the anti-vaxxers. And then the last thing is for our community educators. There's still a need for, better health education material out there to, I don't want to say, make the science behind the vaccine plain. So the flyers that we're seeing right now that are out on the street, basically it'll let you know where the vaccine sites are. They'll give you like education around prevention, like the hand washing, the mask, like we all know that. We've been seeing that for a year and a half. And then we've also seen a lot of flyers out pushing the data. But anything just to make the science plain, anything to encourage our community, to educate our community, to answer a lot of these questions, because we see that there's still a lot of questions behind the science. And we see that there still needs to be a good message out there. And there's still a lot of conflicting information. And so we see that there's a lot of work that needs to be done. But either way it goes, everybody has a role to play. Health educators, the medical community, and our regular African-American, or just our both sides of the conversation community. We all have a role to play. So if everyone can take accountability, step up, open up, educate, talk to other people, and know that you have a choice, I think that we can get past this. But there needs to still be more conversations, and there will be more conversations. But once again, thank you, Nicole and Dr. John. We hope to have you back again because, this will be a continued discussion moving forward for sure.
Definitely. Thank you, Brittany, for wrapping it up so eloquently. That's why we love Brittany at the end. She always gives us a good synopsis of the conversation today, really impact people. Just thank you again. Like she said, the education part is very important. We're going to do our part here at Both Sides of the Conversation, utilize our Educational Thursday platform to get that information out to the community. I think you're right, Brittany. It all comes down to messaging. Sometimes we have to stay away from the sloganship, because a lot of times, when we heard about the defund the police, people started getting real radical about it. And I think we just got to get to a part to really educate people about this, stop using slogans, and just tell people what the plan is, how we're going to execute it, why are we doing it. I think that is very important. I'm glad you said that. But yeah, it's both sides of the conversation. We're going to continue to do our outreach. That's what we're here for, helping change the narrative, getting the community information, bringing those resources and meeting at those intersections. We're going to continue to do our part as we are one of the Dreamkeeper Initiative for Mayor London Breed and for President Shamon Walton and Human Rights Commission. We're going to continue to do our part to impact our community. It's going to take conversations like this to open up that dialogue. And like Nicole said earlier, if this conversation is the one that's needed to start that thought process to go get the vaccination, job well done. and we're just testimonies of what happened. We all been vaccinated. We're here. We're still living. It's not as bad as a lot of people think. You still have the right to make your choice. I'm not here to push you one way or the other. But please, the last thing again, I'm going to ask, if you do test positive or you have those symptoms, please stay home. Do not infect our community. That's all that we're asking. I can't get into the whole, if you want to do it, don't do it. But if you do get told that you're positive or you feel those symptoms, respect the community and make sure that you stay home so you don't infect other people. And that's the best ask that we can ask here at Both Sides of the Conversation. This Tuesday, we'll have another segment this Tuesday at 7 p.m. where we will continue to highlight our Black and brown businesses, as well as community leaders like Nico and Brother John here that do things phenomenal to positively impact our community. This Thursday coming up, we'll have another educational presentation. As I said earlier, we're going to have Ms. Vanessa Russell come back on, educate the community about this technology, entrepreneurship, and these opportunities in IT to get our young people in our Black and brown community involved in this cybersecurity world. As we know, we've been getting attacked left and right. You see all the ransom wars that's going on across this country, and it's going to be important. This is an industry that's growing and booming. So hopefully her presentation this Thursday will help educate and promote and excite some of our community organizations to start looking at workplace development and things in that industry. I think is going to be very, very important. And then next Sunday, we're going to have a conversation about colorism. I think this is a very, very important conversation for the Black and brown community, as colorism has impacted us. And I've seen people in the comments. Please go to our website, sign up if you want to be a part of this, or maybe you know somebody who has a little historical background about colorism, how it's taken place, how it affected us in the community. Please go and sign on. We would like to have you as a panelist. I think this is an important conversation our community needs to have as we're moving forward here at Both Sides of the Conversation. We believe that the pathway to healing starts with communication and having these conversations, and we're going to continue to do that. So with that being said, have a blessed weekend. Be safe. Be the change out there. Do your part. Wash your hand. Wear your mask. Social distance. Don't spread. Don't judge. Uplift each other. Let's do this as a community. We could get through this as long as we all in solidarity together. So thank you all. We'll see you this Tuesday night for our next live episode. Have a good evening, everyone.